Hello, hello. This is Dr. Nancy Duncan, host of Under the Hood, the podcast that dives deep into the world of audiology private practice, dealing with the good, the bad, and the ugly. And today I'm speaking with one of our neighbors to the north. I've got Dario Colletta from Port Credit Audiology and Hearing Aid Clinic in Ontario, Canada. How are you today?
I'm good. Thank you for having me. How are you?
I'm fantastic. Thanks for coming
Good.
on to this. So tell
Yeah.
me a little bit about your practice. How long have you been in ownership? What brought you to start a practice, so on and so forth.
Yeah. So I've had the clinic now. We're coming up close to 8 years in November.
Yeah.
And it's changed quite a bit over the last couple of years.
Mhm.
So when I first graduated school, I started at working at one of the hospitals in the city that I had a placement at. Doing that for a couple of years, and I've always had this itch or knew the only way I think I was going to be fulfilled with audiology is I had to have at least one clinic. And so within a year and a half of working there was a clinic actually around the corner from where I grew up that was for sale. And being that I grew up in Port Credit, I knew exactly the area, exactly the clinic, and knew it would be a really amazing opportunity. So when I had the chance to take it over, I did. And for the first 3 years, I was actually only here 2 days a week.
Okay.
So I would do, going back now, I don't even remember. I would do, I think, a Friday and then be open Saturdays. And then the receptionist that was here at that clinic prior to was kind of here filling in during the week.
Mhm.
What I quickly learned is that clinic was not very busy at all. And then slowly, as we started to become busier and busier, I took a day here, a day less at the hospital, usually for about like the first 5 years. And then eventually we got to a point where, I was, I think, done splitting my time and needed to allocate all my resources to being at the clinic. So about 2-ish years ago, I made the jump and I'm now at the clinic full time.
Probably never look back, right?
No, I am much happier. I mean, I'm sure a lot of people can think about this, but like to look back and wonder why or how I was doing all of that seems really quite chaotic. Because at one point, I was working at the hospital. I would leave there, drive to the clinic to do an evening shift, go home, come back, do it all again. But at one point, I was doing hospital, running the clinic behind the scenes, which of course is a full-time job in itself, seeing people part-time, and then also doing my AUD online. So I
Yep, I
was,
can relate. I did all of that, and it's
yeah,
you do it and don't think anything about it. But then when you look back, like right now, there's no way. There's absolutely no way I could do that at this point.
yeah, like while I was in the midst of it, I was like, this is fine, manageable, I could do it. I would tell other people about it and they
They looked at you like you're crazy.
not comprehend what I was doing. And now I look back and I was like, why or how did I ever do that?
Yeah, yeah. It's kind of like I was talking to
Yes.
somebody the other day. I said, "Yeah, I had my business when I had my son," and they said, "How did you do that with maternity leave?" I said, "Well, I took a week, and then I didn't think about that." But how crazy is that?
It'd take a week. Yeah, yeah. Thankfully,
That's
yeah,
why
when
I
you
have
look
one
back,
child.
there you go. But yeah, thankfully, yeah, when you look back, you're like, I did it. I don't know why I did it like that, but I'm happy that I don't have to do that.
Yeah, yeah. And I think it's smart in the beginning because I know myself when I opened my practice, it was full time, but I needed to supplement income because all the money had to go into the practice. So I worked
Yeah,
evenings for an ENT who their audiologist had kids and needed to leave at 3. So I'd go in at 3:30 and stay till like 8 every night. Again,
yeah,
don't know how I would do that now, but it was easy at the time.
yeah. I think that's why the hospital was so nice because it was like that stability, right? But yeah,
Good.
looking back now, yeah.
So now that you're kind of 8 years into to ownership, how would you define a high performing clinic?
Yeah, I would look at it two different ways when I was thinking about this. I think one side of it is like the clinical administration side of what I think would be like high performing in the sense of course, like having everything streamlined. So I think now like everything being digital or everything being accessed by anywhere, just so that kind of from an efficiency standpoint, everything is easily streamlined. I think too, I mean, part of it is like evidence-based practice, but actually implementing those things. I mean, I know other people have talked about this, but you see it all the time where a lot of clinics advertise things, but don't actually do them. So I think high level or high performing is actually doing what you say you're going to do, which I find is more rare
And you would
than
ever imagine.
common. Yes. I mean, 8 years into it, I'm still surprised by the number of people who have said they've gone to a clinic. And when you ask them the last time their appointment was, it was the day they got their hearing aids.
Yeah, I'm always shocked by that.
Yeah. Or when's the last time you had a hearing test? And it was the day they got their hearing aids. And
I
yeah,
love when they say the last time they got their hearing test was, 5 years ago, and they've got 2-year-old hearing aids on.
yes. Yeah.
Does that work?
That one's a good one too. Yeah. I don't know how that works. But yeah, so that is, so clinically, like actually implementing the things you're going to say you're going to do, using the best practices. And I think technology too, right? I mean, we've seen such a shift in technology that to be using, I think, older equipment or being able to streamline your testing, or add additional testing that goes beyond what most clinics are doing, I think that really sets you apart. So I think clinic-wise or administrative-wise, there's one part to do it. And then I also think about it from like a patient standpoint or like patient experience. I think it's important where as much as we're kind of guiding patients and making decisions for them, I very much like them to feel like they are very much active in their decisions too. So providing them or showing them options, being able to kind of really make sure they also feel comfortable in kind of voicing their opinion or being active in it. This kind of goes back to that same idea of like, I had a hearing test 5 years ago and never since. Outcomes, right? I mean, like high satisfaction. I always start my follow-ups with just a general, how well are things going, or how happy are you with what we've been doing, and kind of leave like a little chart note of 1 to 5, kind of gauging how happy do they seem. I mean, long-term hearing aid use, right? I mean, you have those people who occasionally pop in and they've never worn their hearing aids since the day they were fit, but we see a lot of people who their data logging is 12, 14, 16 hours a day. And
Some that
you're
is
like,
12 minutes.
yes, or yeah. So it's nice to see like a large number of people being like tried and true users.
Yeah. And I agree. I think if you're doing it right, they'll refer people, they'll tell other folks, and they'll be your raving fans.
Yes. So that was like, yeah, my last thing is like the patient loyalty. Like my favorite thing is somebody comes in and they say, so and so told me I just have to come.
Mhm.
Or we have a lot of people now. I mean, we're in a very saturated area.
Mhm.
I think I was looking at it, I think within 5 to 7 kilometers, 10 kilometers at most, there's probably about 20 clinics.
Wow.
So we're in like the greater Toronto area is like very saturated with hearing clinics. So it's really nice to hear when people are coming in and saying, so-and-so told me I have to come. I drove an hour. I really want this experience to be worth it. And then those people are still making the trip, still making the drive, but they're also sending people in too. So that loyalty part it's my favorite thing.
There's not enough money to pay for that. It's one of those things that is valuable beyond our
Yes.
imagination.
Yeah. Yeah. I mean, it's nice to hear because you don't often, I mean, as much as there's satisfaction in like seeing people's response to wearing their hearing aids and how much benefit they're getting out of them, you don't always get like a pat on the back.
Right. What you do it for ourselves often. Now,
Yeah. So
one question I have, because I'm not as familiar with how you all do things up in Canada, but do you have to deal with the same types of competitors that we have here, the Costco's, the big box stores, the third-party administrators of insurance benefits? Do you have all of that?
yeah. So we have Costco for sure. And then we have a lot of the large hearing aid manufacturer clinics. So we have We have like your Connect, your maybe there are different there, but I think there. So you have your Connect, your Hearing Life, um, your Canada, which is WS Audiology. So we have, yeah, so we have a lot of those big box. We don't necessarily insurance wise. I think that's where we differ. I feel quite a bit in the sense that if someone has hearing aid coverage, they get so much. We don't actually get to bill most insurance plans directly anyway. So patients are paying us in full. We give them an invoice and they submit directly to their insurer. But yeah, I would say it's your Costco and your big manufacturer chains that are really it. But like a lot of places, I mean, those smaller private clinics, they're slowly disappearing.
Yes, because I mean, it's my understanding that it could be very outdated. Don't you all have like socialized medicine type of system where people will get these things if they want, but there's a wait, et cetera, or they can go through someone like yourself where it's more private pay?
No. So no, with hearing aids or audiology. So
Mhm.
and this is kind of one of the difficulties when I first started was going from a hospital. That's so a hospital setting um, is, or an ENT's office is really where you'll see the cost of a hearing test being covered by OHIP, which is like the universal health plan for Ontario. But audiology was defunded by OHIP, I think in 2001. So
Okay.
we've always operated as fee for service.
Mhm.
Now the government does contribute somewhat, $500 per year towards the cost of a hearing device, but that's really the extent of it.
Okay. That's
Yeah,
hard to compete in that environment.
no, I mean, so, but I think part of the difficulty in that is people are so under the assumption that OHIP should cover everything that sometimes when you're explaining there's a cost or why there's a cost, you kind of get some head tilts.
Yeah, we get that with our Medicaid systems because it differs by state. And then when I
Mm.
opened, it was only one Medicaid per state. Now there's about, I don't know, 50 probably. And folks think it's the gold card. They're going to come in and get whatever they want. And that's really
Mm.
not the case. So, we deal with a little bit of that ourselves, just trying to navigate that with them and understanding. And then every January it decides to change and we have to figure it all out again.
Okay.
Yeah,
So you
so
must have a whole billing department just for insurance.
I outsource because, and we finally found one that acts more of a consultant towards billing because otherwise they just bill whatever you tell them to, and I don't know what I'm doing. I mean, most audiologists don't. That's our degrees in
Yeah.
audiology, not billing. But we have
Yeah.
to train our entire teams to fully understand it to make sure we're doing it by the book, et cetera. So it's an adventure to say the least. So I am a little envious of you all up there.
Yeah. Yeah. I mean, that definitely, especially too, when there was the talk at the live event in insurers and things like that, I was, yeah, very surprised by how much of a control or change it has over hearing aid pricing and funding. Whereas, yeah, here I mean, I would say a more straightforward system in the sense that if you have some extended health, they'll give you a portion. In rare cases, we have some patients who their insurer covers the total of their hearing aids. So they're paying nothing out of pocket if they have a really great extended health plan. Government's going to contribute $500 per year regardless of cost. But we do find a lot of patients just don't have any extended health coverage. So they're okay with paying for everything out of pocket. Um, and then we do have some third party insurers like a WSIB or the Ontario Disability Support Program, which will cover the total cost for people who are part of that or approved by that too. So I feel like it's more streamlined.
Yeah, definitely is. Definitely.
Yes.
What would you
Yes.
say is one thing that your clinic does better than most that you would say that has contributed to your success?
I think, and this is really in more recent years, just because we've done a lot of work about it. I think it's really like brand clarity in terms of like who we are and what we are, and transparency. I think so. When I first opened, I was kind of like, well, I want as many patients as I can get. It doesn't matter if how problematic they are, if they're a patient, I want them. Whereas now I've learned I don't need to have
Not everybody's your pumpkin.
No, which I mean, I don't also want it to sound like it's exclusionary, but I've come to terms with I'm not the right fit for everybody, nor is everybody coming through the door the right fit for me. So I've been able to come to terms with that. And I think that's helped us grow. But I think that has also helped me clearly define who we are, right? So we're for the person who really wants time during their appointments, who really wants to understand like what is going on, just because we're going to take the time and like really review things, testing, but also treatment options, um, and really wants like that high level of care, right? I mean, we have, I don't know if it's the same there. We have a lot of clinics that offer like BOGOs, like buy one, get one.
We have some here that advertise that.
Yes.
It's not really a BOGO.
Yeah. So we get a lot that advertise that, kind of going back to your original point too, where kind of under the assumption like healthcare covers a lot of our service. There's also a ton of clinics that give away everything for free, right? So in a sea of clinics that are giving hearing tests away as something to drive you in, I mean, we're still getting that foot traffic, but at a higher value, right? So I think we've really been able to be better at understanding really who we are. That makes sense.
Yeah, it does. And I think that's gotten, at least for me and in my world, it's gotten easier over time because when I first opened, every clinic gave everything away. We were a
Yeah.
full bundled model and to say you have a lifetime of batteries. Well, now I'm thinking, well, whose lifetime? The hearing aids, your lifetime, my lifetime? Like whose lifetime? So
Yeah.
we had to rein that in a little bit. And that I was one of the first to unbundle in my area. And
Mm.
that was an uphill battle, explaining to
Yeah.
patients the how, the where, the why. But we also live in an area where many people winter elsewhere. And I really would explain, why do you want to
Mm.
pay for things you're not going to take advantage of? And so
Yeah.
once we were able to have that dialogue with patients, and now it's more readily available at other clinics, it's become a little bit easier. But yeah, it's definitely a challenge to get folks to wrap their heads around it.
Yeah. Yeah. And I mean, there's the hard part too is, I mean, it's so much of this is how things have always been done, right? So kind of like taking a different approach to that, right? So, I mean, this is something where I would have never thought of doing it, but I mean, even putting for hearing aid pricing online, like I would have never thought to do that. But I mean, that has just made life so much easier.
Did you have that moment that I did when we decided to put it online and I knew it was going live and I was like holding my breath, like I don't know what I thought was going to happen.
Yeah.
Nothing
Yeah.
happened. The world did not explode. If
Yes.
anything, I find I get less shocked patients in the office. They're not horrified by
Yes.
costs.
Yes. Yeah. Yeah. It was this moment where I was like, well, now everybody's going to know
Like
what I
it's a secret.
charge. And I'm like, everybody is in and around the same. Yeah, it's not a secret, but yeah, I was like this moment where I was like, what is going to happen if everybody knows my pricing?
Yep. I remember I've worked places in my past where we weren't allowed to even pass out the price sheet to a patient. They say, can I have a copy? They'd be like, no, you can't. It's a
Yeah,
big
you can't have a
secret.
quote. Why would you have a quote?
Right. And then I started thinking of it, the way I wrapped my head around it was, I'm not, if I look at a menu online for a restaurant and they don't list the prices,
I'm not
unless it's
going.
a big fancy event, I'm not going because chances are I can't afford it.
Yeah.
And I thought my
Yeah.
patients might do the same. So if I put it up there, at least it's less scary for them.
Yes.
Yeah.
Yeah. And I mean, I think one of the things I think I'm biased maybe a little bit in this too, in terms of like best, I really like, I mean, patient experience. So I mean, I spent a lot of time thinking about because I spend a lot of time here. So I basically treat this like a second home. So I thought about like, what am I comfortable in? Do I want this to look like? But what do I want the experience to be for like people who are walking through the door for the first time or like their 100th time? So I put a lot of focus on like making it feel as comfortable as possible. So like people are not sitting in a waiting room clinic, right? I had the ability to kind of like, because everything is so local, I mean, there's so many clinics down the street, you could pop over and kind of see where people would sit and wait. But I really think we do a nice job of providing a place that is like comfortable, but it feels fresh, and it's like I don't have any ear stuff up, or I don't have any manufacturer posters up. All of the art is like patients have given me their artwork. So I have one patient who she's a photographer. And so Port Credit is really well known for, it has a lighthouse on the waterfront, just because it's in steps to the lake. So she has variations of the lighthouse at different times of the year, or different kind of landmarks. And so she gave those to me, and we blew them up a little bit and put them all in black and white. And so that's the artwork that runs down the hallway, which people always stop and look. I actually have one patient who keeps telling me to go to his house to look at some oil paintings that he has.
Take a friend
So
with you. I said take a friend with you just in case.
Yeah. I think I'll be okay. But
Okay.
yeah, he's an artist, and he's downsizing and wants to clear out, and is
Wow.
it's pieces like that. So focused it so that way the shift isn't on like what people are reading while they're waiting for their appointment. It's more so they're comfortable during the appointment, and then all of the information is coming from what they're getting out of their appointment.
Yeah, and I think that that's so wise, because I see so many young practice owners get all of their wall art and things from the manufacturer. And I think you're not advertising you, you're advertising them. That's the worst thing that you can do.
Yeah.
Our area was known in the past. I had a lot of like roadside diners and things, the old school, like they were like railroad carts and things like that. So
Hmm.
I had a bunch of those pictures blown up in black and white. And it's so
Yeah.
funny to see the patients just walking down the hall. And you can see them reminiscing in their minds, and it gives them a good memory.
Yeah, people really like it. Because yeah, Port Credit, where we are, it's like it now has changed because it's grown quite a bit. So there's like condos and townhouses and things like that. But when I was a kid and growing up, it was very much this like small town feel. But the nice thing about it is, as long as I've been here, these pictures are really great, because people walk down and they're like, oh, that's the lighthouse, or that's the spot. And then I've learned so much about Port Credit that I had no idea. Like, we used to have movie theaters down the strip, and those have slowly gone away. So it's almost like it triggers something for people, and I get a bit of a history lesson. So it's nice, because it's nice talking points.
Yeah, one of our offices is in an old mill, and I can tell the folks that used
Oh,
to work in that mill, because you'll see them in the foyer just looking around wide-eyed. I'm like, oh, they used to work here.
yeah. Oh, that's cool.
Yeah, so they kind of relive that, and amazed what the building's now become. So it's kind of neat
Hmm.
to see. So now that
Yeah.
you had your practice for 8 years, at this point, what would you say your biggest misstep has been, and to share with others so maybe they can avoid it?
Yes. I mean, this one is without a doubt the biggest, is not jumping, and I kind of kick myself all the time for it, not jumping to being here full time sooner than I did. Which, I mean, I'm sure there was no perfect point for me to make the jump,
Yeah,
but now that I have done it, it's of course something I wish I had done probably at least 2 years sooner.
it happens when it's supposed to, though. So
Yes. Yeah. I mean, it came at a good time. Um, but yeah, that is like the one thing now, if I was to look back and think about like all the maybe mistakes or learning or like roadblocks I hit, I think the biggest thing is just really not making that jump sooner.
just you
Yeah.
should make it after COVID, though. You wouldn't want to make
Yeah.
the jump right before, right during.
No. Yeah. And I mean, yeah, that pushed it a bit, but yeah, just that sooner jump. But I also, I know the biggest mistake is that one, but I do have another one I've thought of.
You're allowed to have as many mistakes as you'd like.
Oh, perfect. I like this. Thankfully, I don't think I have a lot,
Oh, I have
but
books. I would have.
the other one too is really underestimating um, how much of an impact community involvement has. So one of the things early on from the clinic, because I grew up in the area it had the small town feel. A lot of people really like supporting local businesses. So that was kind of a selling point for a lot of people, is knowing that I had grown up in the area. And so I think we used to have a slogan. It was like hearing healthcare with a community first approach, which is great. But we never really
Did anything?
did anything.
Oh,
I mean, we would donate to the local food bank every now and then, or drop off hearing aid batteries, or donate a portion for Christmas time and stuff like that. But we really never did anything like part of the community, which now I realize as we're doing stuff was kind of a mistake, right? Because it's brand awareness.
yeah. And you always get more than you give when you do things like that. When you get
Yeah.
community.
Yeah. I mean, now we have our steady sources. There's the nice thing too about for credit, not always to go back to the area, but it's like right on the water. So they really developed it so that the waterfront is like a nice walking trail. There's restaurants, there's bars, there's coffee shops, all with patios along the water. So in the summertime, I mean, it's packed. Like unless you're here early, you're not going to get a spot. Even the clinic is maybe 5 minutes away from kind of the main drag, and I'll come here on like a Saturday or a Sunday when I'm off just to grab something, and the parking lot will be stuffed. And I realize it's because people are having to park all the way down here and walking down there. But it's been really nice because we're doing more community events beyond like health fairs. We're kind of covering concerts in the park and doing walks and things like that. So like, and being able to like actually be in the community, but people actually see us doing things instead of just donating is really nice.
Yeah, it really does make a difference, and it's long lasting. When I first opened, I belonged to everything under the sun, the chamber, Rotary, and because I had the time. I mean, I wasn't seeing
Yeah.
patients all the time. And it's been years because I just didn't have the time any longer, but we still get folks that remember our time, remember things we did. And we do other things now that are more manageable and aren't time related, but
Yeah.
it stays with people. They remember that. It goes a long way, that's for sure.
Yeah. Yeah. It does. So
What
it's
would you
nice.
say that your best decision has been made in the last 8 years, besides jumping out and going full time?
Yes. So yeah, that's number one for sure. Number two, and this may seem bizarre to a lot of people, is charging for appointments.
Mhm.
So something like a hearing test, uh, kind of like we were talking about before, there's like a sea of clinics where their primary focus or advertising is no cost hearing tests. And so it was something just to kind of be on par with people as a new clinic who's kind of trying to establish a footing, something we kind of offered. And it was like extremely frustrating all the time where people would come in, they'd have a half an hour long appointment, they'd get a full hearing test, they'd get all of this information that comes with it. And then at the end of it, it would be like, well, have a nice day.
Hi.
See you later. And it got to, it was just like disheartening to a point where you're like putting all of this work in. People are leaving with all of this information, and that's it. And I mean, often people would like stop at the front desk and be like, how much is today's appointment? And then like salt in the wound when I had to be like, oh, don't worry about it.
Stabbing. Oh.
Yeah, which, yeah, so it was hard. So the switch from going from not charging for appointments because it's so commonplace in Ontario to do that, to charging for appointments. I mean, of course, all the extra revenue is amazing, but even from like frustration and just, it's been great.
Yeah, I feel the same way because for years I didn't charge because it was that old adage of, well, that's not what we've always done. And any clinic I ever worked at didn't do it. And it
Yeah,
was a big leap and scare. And I can't even imagine not doing it now because we get value for each and every appointment we see. So it
yeah,
makes it more fulfilling and it
yeah,
allows our staff to be better reimbursed. And you get more qualified leads because I'm not for the price shopper. That's not our practice is a boutique practice. It's not for that. So if somebody's not willing to pay for our opinion, our services, and our treatment plan, it's probably not, they're not our person, and that's okay.
no,
Yeah.
yeah. And yeah, so that's also something I'm okay with now is if you're calling for the free hearing test and you're not open to paying the appointment fee that just, I mean, goes with all of the information you're going to learn beyond the hearing test. I'm okay with that now. And it was kind of like when you were talking about like holding your breath when you put your pricing online. I was like, well, we're going to start charging people for appointments. And as much as I was happy about that, I was like, we're going to start charging people for appointments. And I was just like
Hard the
waiting to
first time
see
you say
this.
it.
Yeah, I was like waiting for the schedule just to like
Empty.
disappear and have nobody in it, because who wants to pay for a hearing test? And I think we maybe in the first week got, or first couple weeks got maybe 2 objections, and nobody has ever said anything since.
I think it shows your value. I mean, patients realize, oh, this must be important. This must be different and better. And it is. And they're paying
Yes.
for that. And that's why. And that makes sense.
Yeah. And I mean, I think, yeah, that's why I was always so frustrated, is because like I understood how much of a value there was, but it's hard when the going rate is free. I mean, I think it really devalues the profession quite a bit, right?
And that was that way here. We used to only charge for just the hearing test to the insurance. Well, we'd work an hour and a half with the patient and get $46. Yes, so we found ways around that now because that was just a bad feeling.
Yeah. Yeah. And then it kind of leaves you just feeling kind of,
Useless, I think, and undervalued.
yeah, because I mean, you put all this time in, I mean, going to school, doing all of these extra things, all the work you're doing behind the scenes to then just kind of give it away, right? I mean, at a certain point, you kind of beat yourself up over it a little bit.
Yeah. Yeah. And I wish I could go back, but I think, all right, I can only go forward. So moving
Yeah. Yeah. And I mean, yeah, so that's been the biggest change, is kind of implementing the charges, but also like changing fees too, right? I mean, for whatever reason, our website has always been strong for wax removals.
Same. It's the most bizarre thing.
Yes, I was looking at it this morning, and so this year alone, and I mean, we're only one clinician, but I think this year I've done, and we're kind of just over the 3/4 way through our year, we did 650 standalone wax removal appointments,
Wow.
not including like hearing aid patients where we're including wax removal as part of the service, just people calling in only for wax removal,
Mhm.
with me being one person here.
Yeah.
So it's quite a bit. And we used to do it where it was per ear, and then if you had no wax, it was this fee.
Yeah.
Same thing. I mean, people were coming in and I was taking out wax out of one ear or both ears or no ears, but they were getting the same amount of information in the appointment. And so for me to take wax out of one ear or 2 ears was a matter of a couple minutes, whereas most of that appointment was really dedicated to like all the information. So even something simple like that, where it was an appointment we had always been charging for, but some days I would come in and thinking you're going to make how much, and then you end up making half because there's no wax. So then we've even changed that to just a flat rate, no matter what. And that has been, again, something where I was like, well, who's going to want to pay a flat fee for one appointment, is now something where even our existing patients who have been used to paying per ear have no difficulty in doing it.
And I remember when I opened, I mean, I would be like, oh, it's $30 for your wax removal. And I'm thinking, what was I thinking? We obviously charge much more than that now, but I blame TikTok for the wax craze.
Oh,
Because
yes.
I see so many people in my schedule that's coming in for Saruman management. I'll look at their date of birth and like, they're not going to have wax. They're here because of TikTok. So that's
Yes.
how we started charging, even if they had no wax, because 90% of the time there was no wax. They just wanted to come in and have their ear flushed and feel experience. I'm like, all right, weirdo, let's
Yeah.
go.
Yeah. Yeah. That was exactly it. I was like, for a long time, it was just like people coming in with wax, and we were kind of taking care of it. And then TikTok just became this craze. And yes, it was so many young patients, which nice in a way because they're coming in and we can kind of put some knowledge or kind of think about long term. But I was like, there's no wax. And then I would look in their ears and we talk, and then I'd be like, well, there's no wax, and here goes my half an hour appointment and all of this. But yeah, that was like the driving thing, because I was like coming in, and there were some days where I had a few wax removals thinking you're gonna kind of make something, and then you leave with half. And I was just like, it was, yeah,
No.
TikTok was Yeah.
Yeah, I started valuing appointments and doing it by time, like kind of saying, all right, how much do I need to make per hour? Then breaking it down
Yeah.
to a minute. How many minutes does this appointment generally take? And that was
Yeah.
key because you're right.
Mm,
Even though nothing was accomplished, they took your time, and that's valuable.
yeah. Yeah. And I mean, that's something where we've kind of gotten one or two people where they're like, well, I had no wax. Why are you still charging me? And you're like, well, you still took, I mean, not take up, but you've used a half hour of my
Right,
time. That's half hour. It's not like we just sat here for a half hour. I
right.
showed you what your ears looked like on a video otoscope. We did temps. We talked about what to do and how to manage your wax. So it's like, just because we didn't take out wax doesn't mean you're not leaving with anything.
Yeah.
You're leaving with something new that you didn't know coming in. So there's value in that.
And I've got, the TikTok crew. Can you just, because I'll have the irrigator, can you just use that on me even though there's no wax? I'm like, whatever floats your boat. Like, let's get this party
Yes.
started.
Yeah, that irrigator, I got that. There's the one audiologist who's like big on TikTok, and
Yes.
um she's like the driving force, and people will call and be like, do you have an irrigator? Are you going to use the irrigator? And we're like, yes, we'll use the irrigator.
And then we come out like we're presenting, like, ooh, here it comes.
Yes. And again, people are always fascinated by the name that it is the irrigator, and
I love
they
seeing
love the pun.
on a video otoscope. That's amazing, too. So,
Yeah, I was gonna say, like, the video otoscope and the irrigator are probably like the two best investments I've made in the last couple of years.
yep, absolutely.
Yes.
It's amazing what
Yes.
people will pay to see it.
Yeah. Yeah. That irrigator has paid for itself many times
Absolutely.
over.
Now, I know a lot has changed in my career within our field, and you've been out of school a little less time than I have. But what do you think the future of audiology in private practice looks like?
Yeah. I tell people this a lot lately. I feel like right now is a very exciting time for audiology.
Mhm.
I'm like really excited about hearing aids and kind of what people are experiencing with the new hearing aids, especially people who've been wearing hearing aids for like years and years. So with like the introduction of like AI and things like that, I think we're really solving a lot of problems that people with hearing aids have always had. So in terms of like change, I really think there will be a nice change in terms of like technology, also technology literacy. I think people are much better at being able to take care of a lot of the tech on their own. We're not as much hand holding with certain things.
Especially with the Bluetooth and all of that.
Yes, yes. So having that where, yeah, people are connecting to their Bluetooth, or they're coming in to pick up a repair and we don't have to spend the 5 or 10 minutes to pair it for them because they're happy to do it on their own. So I think that I think will continue to get better. So I think technology is going to drastically change how well people are hearing and kind of hopefully be a driving force on getting people coming in younger, just because instead of it being the case where people's experience with hearing aids is, oh, I know somebody who doesn't wear their hearing aids.
Mhm.
Now it's, I know somebody who wears their hearing aids. They have AI in it and they love it. So I'm hoping that that changes kind of people's thought processes around wearing hearing aids.
Yeah, I
I
think
don't, yeah, which I've already seen it too, in the sense that, and maybe you've seen this too, the age of someone coming in being fit with hearing aids is much younger than ever before.
yeah.
Yes.
I think a lot of that's the cognitive decline push of knowledge. Because when I first opened 22, 23 years ago, probably the youngest person, I mean, if I saw somebody that was 65, like, oh, they're young, like that, I have a young person in my schedule today. And now often, my patients are all in their late 40s, early 50s, because
Yeah.
they are more in tune with their body and understanding this, there's a change, more apt to, they're not the rub some dirt on it generation of, I can put up with it. I just turn the TV up louder. They want action.
Yeah.
So I
Yes.
definitely have seen that. Absolutely.
Yeah. Yeah. I was going to say there's been a really big shift, I feel like, in the 40 and 50 age area which is amazing, where people are just coming in, but they're also so much more open to it.
Correct. It's
Like,
not
oh,
an embarrassment factor anymore.
yeah, they're like, I need hearing aids. Great. How do we do it?
Right. Yeah, and I mean, and there used to be a huge stigma. I mean, you would have thought I told when they had cancer, when I said you have hearing loss, you need hearing aids, the resistance you would get. Now it's,
Yeah.
"Okay, how do we make this happen? I need that. I need help." Especially with the advent of introducing testing and noise and things like that. They realize and they see it and they want something done because they're more social beings, I think, than our previous generations.
Yeah. I mean, I like probably a lot of, I mean, most of my patients are gone
Mhm.
most of the year, and they're not just going away and hanging on a beach. Like they're on cruises, they're out and about.
Yep.
They're probably going out more times a week than I am in a month.
Of course, you're at work all the time.
Yes, that's true. Yeah. Um, but yeah, it's amazing to see that. But I really like the shift in the sense that it's like, okay, I have it now. What can we do about it? Instead of like it being like, okay, we have to do this, and it's like dragging people to it.
I think we've become more of a proactive field of practice than we were before. It was reactive before. Like, we've got this problem, this is how we're going to fix it. Now we're seeing them before the problem starts and guiding them through that
Yeah.
process, which I think is where we always should have been.
Yeah, and I think it's great to see we're finally starting to get there. Because yeah, I mean, a conversation I have with so many people is, well, my parents never wore hearing aids, and you're like, well, your parents probably should have worn hearing
I didn't
aids.
need them.
Yes, but them thinking they needed them and them actually needing them are like two different things. Yes. Yeah.
So looking forward, to like we already talked about the
Mm,
future of audiology.
yeah.
If you were going to be talking to a bunch of folks considering private practice or new to private practice, what's one piece of advice you'd hand out to them?
Probably focus on yourself.
Hmm.
I think, and I mean, I'm sure most people are guilty of this. I definitely was, and this consumed a lot more of my time than it should have, and probably created more stress. Was I was focusing on what everybody around me was doing. So I think I was putting too much focus on, well, what is the clinic down the street doing, or what is that clinic up that way doing? And when that time should have been focused on, well, what am I doing? I think I got so caught up in it that it really did eat up a lot of my time.
And I think that's sage advice because I know I did the same exact thing and I was always stressed, like trying to keep an eye
Yes.
on my pulse on what they're doing and what they're doing. And once I had the freedom to go, what do I want to do? We were then the leader of the pack and everybody was trying to keep up with us. But before that, I was just lost in the noise because I was trying to be like everybody else.
Yeah, I was going to say, it was one of these things where I was just, I mean, I think it's important to keep tabs on what's going on in the neighborhood, but it was just too much time was being focused on, well, what are they doing, or what can I do because they're doing this?
Mhm.
And then when I stopped thinking about that, I got to this point where they didn't occupy as much of my time. And I just felt like being at the clinic was more relaxing, but I felt like we were just more things were just getting done, and things on my to-do list that have always been on my to-do list were finally getting checked off.
Well, it freed up a lot of headspace, I'm sure.
Yes. And then I mean, then we got to a point where I feel like we were starting to be ahead of the pack or leading the pack. Then we got to a point where people were then basically copying and pasting parts of our websites or things
Yeah.
we were doing, which, as irritated or pissed as I was, and then that was like a whole other series of things. I was like, in a way, I was like, that's showing me what I'm doing is kind of leading what I think maybe other people want to be doing.
Correct. We see that all the
Yes.
time. We do one thing and then we see on their website they're advertising that. And that just tells me, well, I just got to up the game. I just got to keep up
Yes.
with the game. So then I'm just in competition with myself.
Yeah.
Um, and then I like that. I like doing that. And, at one of our book club things, I don't know if you were in the group yet, was, the theory of marginal gains. Let me just be 1% better today than I was yesterday. And if you keep doing that, you will absolutely lead the pack.
Yeah.
I think you're right. Focus on you and what your goals and mission are.
Yeah. I think that if if I could have started like that from the beginning, that would have been great. Yeah. That's the
You
biggest
follow the
thing.
path, we all do, because you don't know what,
Yeah.
so you try to compete with everybody else.
Yeah.
Yeah.
Mm,
And it's scary and
yeah.
confusing and
Yeah. I
all at
think that's the
once.
biggest piece.
So I have forgotten the last two
Yeah.
podcasts, but one thing I do, because this is called Under the Hood, and I am a car junkie.
Oh, yeah.
What would be your dream
Yeah.
vehicle if money was no object and you can drive whatever you want? What would you be driving?
Oh, this is a no-brainer. It's been the same car ever since I was a kid.
Okay.
And all I've ever wanted as a kid was a G-Wagon, a Mercedes
Oh, really?
G-Wagon.
They're beautiful.
Yes. Yeah, yeah. People have hot takes on them. Some people think they're beautiful, which I think they're amazing cars.
Yep.
Some people think they're the ugliest car on the planet. But a G-Wagon has always been the car on my list.
I saw the most beautiful G-Wagon in New York City once. It was a matte gray, like a deep steel gray, and it was the matte
Yeah.
paint. It was, I mean, just beautiful.
Yeah, they are. Yeah, I mean, around here, they're actually like pretty common to see, which is like every time I drive by one, I'm just like, But yeah, that has been the car, without wavering. That has always been my dream car, which
Someone was like, "You should get a G-Wagon next." I said, "I'm 4'11". How am I going to drive a car that big?"
you get a little step to get into it. But yeah, I'm slowly, with each lease, I'm trying to slowly make my way to it.
Well, if you keep doing what you're doing, you will be there in no time. I guarantee.
Yeah, yeah, fingers crossed. Matte Black G-Wagon.
Well, if someone out there is listening and wanted to get in touch with you, what would be the best way for them to do that?
Yeah, probably email, which is very easy. It's Dario at pcaudiology.ca, or Instagram, Port Credit Audiology, which I have taken to being more on social media, and I probably share more of my life on my business account than I have ever shared on my personal account.
Personal.
And people really do like that. So,
Yeah. And I feel like too,
yes.
patients, the more you show who you really are, they love that. I used to, when I
Oh,
was younger, be that white coat. I have to be the doctor. I have to be, super professional. And now that I'm just myself, patients just love it.
Oh, yeah, they love it. I mean, I moved in December, and so my backyard has never been touched. So I gave my family free reign to come plant whatever they want in my backyard. And people want updates on my garden and my vegetables. And
And put that
I,
in your newsletter. They will love that.
oh, they eat it up. Or a couple of years ago, I ran a marathon and I run half marathons. And so,
Bless you.
uh,
I don't even run when
yeah,
I'm being chased.
oh yeah. I think marathon is like one and done. There was a lot of tears. Um, it's a lot of tears. But half marathons are really doable. They're fun, actually. But I had no idea. Like, I had one patient who has run 24 marathons, including like four of them being the Boston Marathon, and
Oh my
he's done
gosh.
them in like sub 3 hours. And I would have never known that unless I put into my newsletter that I was training to run a marathon. And it's like so nice where instead of it always just being like, oh, how your hearing aids doing or how are you doing, it's now you can have like these deeper conversations on something that's common. So I really do like it.
Yeah, and I mean, I told you earlier about I have a crazy dog, and we started putting stories about the dog in the newsletter. And I'm amazed at when people mention that in the visits or send me pictures of their dogs. I mean, it's so funny
Yeah.
to see. They just adore it. So
Yeah. It's really nice when people really latch on to some
when
of
they
the
feel a
things in there.
connection, it makes you,
Yeah.
that's for sure.
Yeah. Yeah. I mean, it's really nice. Or even too, in June when I was in London and then I went to Amsterdam, I tacked on a bit of a vacation for it. I'm seeing patients now, like 2, 3 months later, who are like, well, how was London while you were there? And I was like,
Yep. Yep. Same. It's amazing. They just want that connection and they value it so much,
yeah,
which is the
yeah,
name of the game. So, well, I
yeah,
appreciate you taking time out of your busy schedule to
me
be with
too.
us and all the insight that you provided. So thank you so much.